We've seen President Trump repeatedly say at his campaign rallies the coronavirus pandemic is ending, despite a spike in cases in almost every state. Joining us now is Dr. Ann Liu. She is an infectious disease physician at Stanford Health Care. Well, thanks for talking with us. So let's set the record straight. As a doctor, what is the message you'd like everyone to know?
We are well into a third wave nationally. The virus is still highly contagious. That hasn't changed, but masks are still very protective if used correctly. We know so much more now about how this virus behaves and how to control it. We have so many more tools at our disposal and have had a lot of experience now with getting it under control. And I think people need to understand that we're in this for the long haul. We are always about 1 month away from getting control of this virus, not eliminating it, but getting it under control. That means that if everybody does what they're supposed to do now, we will see the results in about 1 month's time.
Okay, well, Dr. Liu, we know a new study looked at antibody immunity and if it sticks around or if it wears off over time. What are the results of that study?
So this study showed that SARS-CoV-2 antibodies declined by about 25% over the course of 3 or 4 months. This is pretty consistent with other studies published on the same topic. But the important things to know are that this is probably a normal and expected decline. It does not mean that protective immunity is lost. And during the acute response, the immune system creates antibodies and produces a lot of cells to churn out those antibodies. But once the infection is over, then the immune system instructs those cells to stand down and weeds out the excess cells. But some longer-lived immune memory cells will retain the ability to multiply and create a lot of antibodies that should come back if the virus were to re-enter the system. This is just part of a normally functioning immune system, and problems arise when the system cannot tell those cells to stand down. You don't want your immune system to be in a supercharged response to every infection that you have ever encountered all the time. We do have some limited data on confirmed re-exposure to the virus in people who have already had the infection and what antibody levels are, but we don't know that much about what antibody levels are predictive of protection. Extrapolating from other similar respiratory viruses, we think protective immunity probably lasts at least a few months, perhaps longer. We are not counting on lifelong immunity or immunity really beyond a year or two. There have been several cases of confirmed reinfection in patients who were previously infected. So it's possible, but we need to understand more about it, but that's probably not the norm. Regardless, herd immunity through natural infection is not a viable or humane strategy.
Okay, well, we've been reporting on potential antibody treatments, and now one company, Eli Lilly, is ending its trial. What happened there?
So this was the ACTIV-3 trial that was funded by the NIH. And in this study, one of Eli Lilly's monoclonal antibodies, also called, this is a tongue twister, bamlanivimab, was studied in hospitalized COVID-19 patients. We don't yet have the full data to review, which will come later. But what we know so far is that this antibody did not help COVID-19 patients who were sick enough to be hospitalized. They are still going to continue to study this antibody for patients who are not hospitalized and also in combination with another monoclonal antibody. And I understand they are also studying it for prevention of disease in high-risk patients who have not been exposed or contracted COVID-19. So other antibody data, such as that from Regeneron, suggested that the most benefit may come from early administration to patients who have not been sick very long and have not yet developed their own antibodies. So more to follow, but this is not the end of the monoclonal antibody story.
All right. Pretty early on, we knew COVID-19 is more deadly for men than women. Do we know any more about why that is?
There is a lot of speculation on the reasons for this. Some researchers are looking at underlying sex differences in the immune system. Others are looking at differences in behavior between men and women, including differences in the types of jobs they might hold, the likelihood of exposure, differences in mask wearing, and differences in perception of COVID risk, which might change how somebody tries to prevent the virus. thus far, everything is just correlations and nothing has really definitively explained the difference.
So we are still learning. All right, Dr. Ann Liu at Stanford Health Care, thank you.